Hi, this is Tracy Cole from the Fort Myers campus. My presentation today is how to live with PTSD. PTSD, the etiology, the causes of the disease, what organs and cells and tissues affected by the disease, and which organ system is affected. The etiology of PTSD. Etiology, let's start by defining the word etiology, is defined as what is the cause of matter of the disease. The etiology of PTSD, post-traumatic stress disorder, is a major life trauma by either severe head trauma or life event, usually in the early childhood years. It's a traumatizing event by a family member. There have been studies that certain families members can cause PTSD in the other family members as in children. OCD and panic attacks come hand in hand with the disease. Causes of PTSD. Like myself, veterans from wartime experience traumatic events there, things they see, things they do. Horrible events with family that they had to see or go through. Major head trauma or injury, like major car crashes or just any kind of head injury. And also includes, as I discussed earlier, auto accidents. The cells and tissues and organs affected by PTSD. The cells, which is the chemical compound of the brain. Tissues, all muscles in the body, and they're caused by fatigue. Organs is the hippocampus, heart, brain, spleen, and lungs, and we'll go into more detail in the next couple of slides. The cell portion affected by the disease is mainly the chemical compound of the brain. When there's many severe accidents or major traumatized life events happens with this effect. All the muscles in the body ache, and there's so much fatigue within the body. The organs, all of the main organs are affected by the disease. The main one of the brain is the hippocampus. The hippocampus, there's a part of the limbic system of the brain. This has the responsibility of storing and recalling memory, whether good or bad. When it is damaged, this is where the difficulty in remembering or restoring memories. Some people say they experience short-term memory. The hippocampus also plays a role in overcoming fear or the tragic event if possible, but for most this does not happen. The spleen, heart, and lungs are also affected. They're affected by PTSD, some due to trauma and others due to stress by having this disease. The spleen is affected by causing ulcers, bowel difficulties due to stress or trauma. The heart is affected also by the stress, and it could be done by the trauma. The lungs is also affected by the stress and the fatigue. Not wanting to do anything, just to sit around, stay secluded inside the house. Living with PTSD, this is one of the hardest things that, as myself and other people that experience the disease, have to do. People that have PTSD, we have to adapt to our environment, learn how to live with the disease, and to learn what our triggers and signs of the disease. Medications for some people can control it, but for other, counseling, therapy, sometimes even reliving the incident helps one overcome their PTSD and their fear of the same thing. There's a lot of signs for this disease. They call it triggers of the event. Like for me, it's fireworks. For a lot of people, soldiers, it's fireworks, because nowadays the more modern fireworks sounds like gunfire or explosions. It's really hard. But getting diagnosed is a major part of the disease. If you get diagnosed, then get the help and the therapy, not just medication, that helps out in the long run. What comes with PTSD is anger, rages, or fits. Also, certain smells or sounds, or a certain race, how they dress, how they talk, could also be triggers. It's just really hard to adapt. All these can cause long-term harm to the body. So it's best, if you think that you have it, get diagnosed for it and either take the medication or go to the therapy or group therapy. A lot of the veterans, they go through group therapy to try to help. Symptoms of PTSD, which is flashbacks, nightmares, sweats, depression, anxiety, anger fits. These are just a couple of the symptoms that is created by post-traumatic stress disorder. Here's some increments. B is for behavioral, which means you're agitated, irritable, you're hostile, you're paranoid, you're super vigilant. Also, you can be self-destructive behavior and you don't want to socialize with anybody. Psychological, the flashbacks, the fear, the severe anxiety, mistrust, depression, that plays a big role. Mood is you just don't care. The guilt, the survivor's guilt, loneliness. You don't want to feel the pleasure that other people feel. Sleep plays a major role in it. Just a lot of insomnia and nightmares, which also include in this like no emotional attachment to nothing, or as they say, unwanted thoughts, which is suicide. A lot of the veterans go through that. Treatments and preventions for post-traumatic stress disorder. There is, as of now, there is no cure for it if you're diagnosed with it. A person, what I've been taught, and you have to adjust your lifestyle to the disease, not the disease to the lifestyle, because it won't work. Always find a support system as family, friends, other vets that or other people that's gone through this similar, same, event that you did. According to my research, the past 4 years, the age groups that have the disease go from, believe it or not, from the age of 3 up to 60 and up plus. There are several psychotherapies for the disease. And there's also medications for post-traumatic stress disorder, which is Prozac, Zoloft, and Paxil is the 3 major ones. But when you get involved with medicine, you usually take like 3 or 4 different ones for 3 or 4 different reasons. Like trazodone to sleep, or insomnia, it just depends. Therapies, you can go and discuss it, cognitive behavioral therapy, eye movement, disassociative and processing, exposure, responsive prevention. You can see a PCP, which is primary care provider. You can see a clinical psychologist that can treat the disorder with just by therapy, by talking it out, like in group. And psychiatrist, it treats it with medicine, with the disorder. A lot of people confuse PTSD with mental disorders, and you can have a mental disorder, but it's 2 totally different things. The short-term and long-term consequences of post-traumatic stress disorder. If you have any kind of long-term chronic illness or disorder, it can have dramatic consequences of the body after a long period of time. This particular disease is made up out of stress for the events, the survival guilt, I mean, some people have lost permanent memories. They don't want to be attached to anything. The conclusion of my presentation about post-traumatic stress disorder can cause major issues amongst family and other loved ones. A person should recognize the triggers if you have it. Depression does play a major role in it. I just suggest you go see a doctor, psychiatrist to get diagnosed for it. And these are the references that I found my information. Thanks again. This was Tracy Cole from the Fort Myers campus.